Welcome to the Health Channel, all health, all the time. I'm your host, Kathy Buccio, coming to you from the Baptist Health South Florida studios. 178 million Americans are missing at least one tooth, me included. That is according to the American College of Prosthodontists. Did I say that correctly?
Correct.
Okay. Now, to put this into perspective, that's over 50% of Americans. Now, fortunately, today's dentists offer more options for a brighter and more natural-looking smile. And here to talk about this today is Dr. Howard Abrahams, a maxillofacial prosthodontist at Dental Implants, Miami Beach. Welcome to the show, doctor. It's great to have you.
Thank you very much. Glad to be here.
Okay. Now, for those of you that might not know, tell us a little bit about background and what it is that you do.
Okay, I'm what's called a maxillofacial prosthodontist. Difficult to spell, but what I do is basically, I've been to dental school, and after dental school, it's an additional 4 years of training where we really spend time treating large and complex dental cases. The maxillofacial prosthodontist is actually an extra year, which was spent, in my situation, in a cancer hospital in New York, in Sloan Kettering, which is a very well-known cancer center. And we treat patients who've had either going through cancer or have been treated for cancer. And what happens is, a lot of times, they'll have tumors or all kinds of things cut out of their mouths. And it is my job to replace those missing parts, not only teeth, but palate, and could be an eye, an ear, a nose, all kinds of different things.
And we're going to get more into oral cancer later in the show. But first I want to know, besides these patients, what other type of patients are you seeing?
Okay, in my practice, private practice, we really see all types of patients, anything from, regular type of dentistry, cosmetic dentistry. Certainly we see the cancer survivors usually. And it ranges in age. We have adolescent patients who may be missing it. Maybe they were born without a tooth, very common type of thing where someone's born without a front tooth. And we also see the elderly as well, everything in between. A lot of people, like you said, a lot of people are missing teeth.
Yes, I was one of those who was born without one of these teeth on the side too, so I'm part of that statistic. So as we get into our discussion, I want to take a moment to let our viewers know that you can call in and join the conversation or ask a question. The toll-free number is 855-796-4475. We would love to hear from you. So let's get into what you spend most of your time helping patients with, and that is implants. So what exactly is an implant?
Okay, basically, an implant is an artificial root, usually made out of titanium. It's implanted into the bone, much like you hang a wall. Well, here's an extreme case, one of the cases that we do, where a patient, we extracted all the teeth, we put in multiple implants. In this particular case, we were able to affix teeth that same day.
Wow. So it's almost like a screw that goes into your
jaw. And then you have a number of choices of what you can put on top of those screws. Things that are removable, things that get screwed in. So there are a lot of different options out there.
That's fascinating. So how common are reasons for people needing implants?
I would say very often it's neglect. They just didn't take care of their teeth. They can have periodontal disease where they lose bone over time. It could be as a result of trauma. Maybe they got in a car accident or hit in the face or something of that nature. Cancer related, they've had surgery to their face and it's affected the bone, and some teeth were removed inadvertently, or not inadvertently, they had to remove it.
So how can that affect, having a missing tooth or teeth, how can that affect someone's, I guess I would say, cosmetic journey almost?
Well, cosmetically, I mean, like you said, a lot of people are missing teeth. You can live without a missing back tooth, let's say that.
Right, but a front tooth.
Front tooth, obviously, it's socially not acceptable. Also, it can ruin your speech. When you speak, your teeth and keep the air flowing the way it's supposed to go, so air is going to be flying all over. Patients all the time say, I'm spitting all over the place when I speak. So it can affect, your job, how many, you have to have a nice smile.
It's a first impression.
Exactly, first impressions. You gotta look good.
Absolutely. There seems to be a range of benefits to getting implants, and I want to share these with our viewers. If you can take us through these, Dr. Abrahams. First one, obviously, as we were just discussing, a natural appearance.
Natural appearance. Well, the truth is, I think all dentistry should really try to restore a natural appearance. But I think what probably this is referring to is very often when patients lose teeth, they also lose bone, and their face can cave in, and the implant can, maintain that natural look of a face.
And you would say that it prevents that deterioration as well?
Yeah. Teeth, you lose bone after you lose teeth because the bone's not being stimulated. It's kind of like when you break your arm and come out of the cast, it's like a little shriveled.
Right.
So by having the implant in there, and by virtue of using that tooth, the bone is being stimulated and the bone is maintaining itself.
One of the things I notice as well, if you have a missing teeth or a missing tooth, it can also shift your other teeth because there's that gap, correct?
This is true. A lot of that depends on the patient's age. The earlier you lose a tooth, the more likely you're going to have all this type of shifting. But yeah, it can definitely destroy your bite by missing multiple teeth, and it really can cause a whole host of problems.
I know that you brought some samples of implants because there are a different variety of those that you can use. So if you can share those with us, that would be fantastic.
Sure. I mean, really what I did is I just brought samples of what can be done for an implant. So this is an example of, just someone who's missing a single tooth. The old style, we would do what's called a bridge, where you would shave the adjacent teeth of the missing space.
I have one of those, yes.
Okay, a lot of people do. And with implants, you have, instead of, ruining the adjacent teeth, you can keep it in an isolated site and keep it as a single. Like I said, usually it's a titanium screw that goes into the bone, and then you have a crown that gets cemented on top of there or screwed in.
And then the other ones as well. Oh, this is, you can see that.
Well, I brought a whole bunch of toys, but if we want to just stick to implants, we can talk about, now if you have, that was really for missing one or a few teeth. If you're missing all your teeth, there are a lot of different options, and I think this is something that patients don't realize. You can have implants, and you can actually have a denture with snaps in it.
What is that? So it snaps into your...
It snaps in. Now, I will tell you, even when I put these in, especially in patients with problems with their, maybe more elderly patients, they can't get these things out.
It requires a lot of heavy lifting almost.
And there are advantages to this type of thing. Number one, it's typically less expensive, just because it's less demanding in terms of laboratory and hardware.
So these snaps are put...
Well, the implants have... Think of it as a button, like they have a male part, actually a female part on the implant, and the male part goes into the denture and it snaps in there.
That's so interesting. My question for you is, because these are snaps, is there a problem with food accumulation when it comes to these?
Okay, so it's a good question. So these are actually, if you think about it, they are more hygienic than having something like this, where you have teeth that are screwed in, and you see these advertised all the time, and and they're great. But if you think about it, you're going to get stuff underneath there, and it's much harder to clean this out as opposed to actually being able to remove the teeth.
That's a great point.
So hygiene is definitely better with the removable. On the other hand, just from a mental acceptance, some people are not willing to accept having to take out their teeth, and I totally understand that. Yeah, I mean, it makes sense.
Becomes it's an individual choice.
Yeah, it's
absolutely.
A choice.
Okay, so you brought some before and afters as well, so that we can actually see this in full effect. So if you can show us a little bit of what's going on here.
Okay, sure. Well, this gentleman just basically had not been to the dentist in a very long time, lost teeth. Things were, as usual, things have shifted. They were missing teeth. You could see the upper teeth kind of grew down, because teeth like to have something to go against, and when they don't, they will actually migrate downwards.
Right.
But because of that and some periodontal disease where he lost some bone, and you could see those on x-rays, basically we removed all his teeth, and he has a combination. On the top, he's wearing a removable type of prosthesis similar to
the snap-in
type of thing. And on the lower, he had, I think we put in 7 or 8 implants
Wow.
and bridges that were cemented into place. So he had a combination.
That is incredible. Wow.
you.
Okay, we have another patient here.
So this was a very interesting case. The patient had already come in with some implants done, and I think she may have had some substance issues.
Okay.
And that's another thing I didn't mention. That can also really wreak havoc on someone's teeth. You know, all kinds of different drug use and
Right.
this and that. But what we did, again, we removed all her teeth because she had a very bad diet as well. So she was always eating crackers and stuff and sticky stuff. So her teeth were not going to survive. So we removed all the remaining teeth.
Right.
We utilized some of
well, yes.
we utilized some of the implants that she already had, and we added more implants. And we made a number of cemented bridges for her.
Wow, that's a remarkable smile. What a difference. Now coming up, we're going to talk about cosmetic options to enhance your smile. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, call in now using the toll-free number 855-796-4475. Remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch the Health Channel 24/7, and you can also download the Health Channel app for your mobile device or smartphone. It's free, available at the App Store or Google Play. We'll be right back.
A double lung transplant is probably the most difficult surgery you can get. Being able to breathe, it is a feeling that you want to rejoice instantly. I can walk, I can talk. When I get up in the morning, I always thank the donor. I thank the surgeons. I thank Florida Blue because they were so helpful. My case manager, she was the one responsible for getting liquid oxygen that I needed when no one else could. It's what kept me alive. My favorite time is to walk during the sunrise because it reminds me of a new beginning. I'm Ed Henry, and this is my kind of blue.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Hey, have you been watching the Health Channel?
The rainbow, baby.
Every color. Your neighbors have. Here's what they're saying.
Amazing information, smart content.
We love all the tips you give to parents.
Highly recommended.
We're answering your health questions 24/7, 365 days a year.
Hi, May. Do you have a question for Amy and Shannon?
Find us on Comcast and Hotwire Cable, download us on your phone or tablet, and visit us at allhealthtv.com. The Health Channel. All health, all the time. We're here for you.
Welcome back to the Health Channel, All Health, All the Time. I'm your host, Kathy Buccio, and with me is Dr. Howard Abrahams, a maxillofacial prosthodontist, right?
Prosthodontist.
Okay, I'm getting
we'll
there.
We'll get it by the end of the show.
We'll get it by the end of the show at Dental Implants Miami Beach. Don't forget, if you have a question, call in. Use the toll-free number 855-796-4475. Now, white, bright, and straight are what you expect with a perfect smile. And if you're feeling self-conscious, there are a number of options for patients today. So when it comes to these issues like discoloration and crookedness, these are things that could be purely cosmetic, or can they be linked to health issues, Doc?
Well, I think crooked teeth especially has been shown to accumulate more bacteria, okay? Now there's definitely a link between bacteria and different diseases. There's been links, probably in the last 20 years, there have been studies to show there are links between cardiovascular disease, psoriasis, kidney disease, Alzheimer's, colon cancer. So there's definitely a correlation between bacteria in the mouth and bacteria found in the body.
I know that you mentioned that your goal is to have patients look their best self, also looking natural, because that's also something that's very important to patients as well.
Sure.
Why do you think that is?
I think it's the society we live in, and everyone's always in pictures, and you have to look good in your selfies.
Yes. There's even filters for good teeth.
Oh, yeah, right.
There are.
Right. So looking good is part of the norm now. It's a cultural thing, especially in America. Maybe less so in England. Sorry, Britain. Sorry, British guys. No, but it's as important as being fit,
right.
Dressing well. It's just part of the whole package, I think.
Absolutely. Now, you mentioned how much has changed in the last 10 years alone. Can you talk a little bit about that evolution of that history of where we are today when it comes to this cosmetic dentistry?
Yeah. So I would say originally with dentistry, cosmetics were not a concern at all. It was really about function. So if older crowns and prosthetics were made out of gold. I think, the price of gold skyrocketed, as probably most of your viewers know, and the industry started looking for other materials. Mm-hmm. At the same time, cosmetics became more important. And the evolution of the dental crown, for example, is it was first gold, then porcelain was developed, but it was porcelain that was baked on top of a metal. And if you notice people with old crowns, sometimes you'll see they'll have like a gray hue around their teeth, and that's usually you're just seeing the metal showing through.
Right.
So then, later what developed was a couple of generations of stronger porcelains, but something called dilithium silicate, which is a stronger type of glass or porcelain. But now, I think the biggest advance that we've made is zirconia. It's a very hard material.
And that's what's being used now.
It can be used. The majority of what I'm doing now is in zirconia. Number one, because it does not break. It's very difficult to break zirconia. So for the dentist, it is very comforting, not worrying that your porcelain's going to chip, right, and that kind of thing. And also for the patient, it's there's less remaking of crowns that have chipped. I mean, I can't tell you how many crowns I've remade because the porcelain on their old one is chipped.
Mm-hmm.
So I think that's a big advantage.
Durability is key.
Durability is, and it looks nice,
right.
And it's
looks
getting
more
better,
natural.
And it's getting better every day.
Absolutely. Now, I want to remind our viewers to call in if you have a question. That number is 855-796-4475. We'd love to hear from you. Okay, so let's talk about those options for a brighter smile, because it seems like there are more options to do it yourself, these kits that you can get at the store, but are you going to get the same results as if you go to your dentist office?
Okay, so it's a great question. People ask it all the time when they're in my office. And when they see me on the street, of course.
They say, I want to get your smile.
Well, sometimes. But no, here's the story. Crest white strips and things you can buy over the counter, or they were doing it in the malls, in the kiosks. So does it work? Yeah, it works to an extent. There was a study, I think it came out in April of this year, showing how the at-home treatments, ones not warranted by the dentists, were actually damaging not the enamel, but the dentin, which is the layer underneath the enamel of the tooth. And why is that? Well, because the ones that are sold, at CVS or Walgreens, they use hydrogen peroxide as their main whitening agent.
Right.
Okay, and that is damaging. That's what the study showed. The dentist has...
Why is it allowed to be sold then if it's damaging?
Well, I mean, the research, why do they allow Cipro? Why do they allow, they don't know until it's been around long enough and, they find out, this is
not working. Right.
Yeah. We use carbamide peroxide, which has hydrogen peroxide in it, but it's in a different state. It's more stabilized, so it's safer. And, and you have the advice of your dentist saying, you are a candidate, or it will be good for you, or, because whitening does not work for everybody. I tell every patient that you cannot predict how white someone is going to become. So I tell patients that it's very important because you don't like to have a patient disappointed.
Right, but you have to be very upfront with them. So you do offer teeth whitening in your office, a specific teeth whitening. Can you talk about that?
Well, we offer two types of whitening in our office.
Okay.
We offer what's called at-home and in-office. Basically, the at-home is we make custom-made impressions of you, and we give you whitening agent, and you wear that. It's about a 1 to 2 week process for about an hour to 10 hours a day. We haven't had anybody, overdose or die from whitening yet.
Just very, very bright teeth.
Yeah. But that's one way to do it, and it's a lot less expensive for the patient.
Right.
And the truth is, I will usually recommend that to the patient, because like I said, whitening is unpredictable, and if I can't predict what's gonna be the result, I hate to see the patient spend a lot more money on the in-office treatment than the one that they would do in the than at home.
But if you do the in-office, how does that one work? Is it a couple of sessions?
It can be, depending on how stubborn the teeth are in terms of whitening. And usually it takes about an hour and a half. You sit there, we put on Netflix for you, and some formulations come with a light that help accelerate it. Some formulations don't need the light. The truth is, with the light just accelerates it. You don't really need the light. The whitening agent will work over time.
Does it still have, I remember from when I first got my teeth whitened, does it have that almost sharp sensation that it's very sensitive? Because I'm still a little haunted by that one.
Yeah, so that's also something that I discuss with the patients. If they have sensitive teeth, I don't recommend doing it in the office because it is a much higher concentration. It's you get this sensitivity. It's not long lasting, maybe a day or two.
Right.
But still, it's annoying. Yeah, and of course, I did it for my sister-in-law, and she's in agony. Most patients are fine, but when you do it on friends and family, it's always...
Right, they blame you.
Yes.
So do you recommend, let's say, even when you go to the store and get your toothpaste, and you see the whitening effect or whitening agent, do you recommend getting those?
Yes, I
do? Okay.
I think they're effective. I don't recommend patients get the ones with the baking soda. I feel they're a bit more abrasive. And if there's talk about the charcoal toothpaste recently.
Yes, I've seen that.
So another study recently came out saying it's not good. In fact, it's bad because it's so abrasive that it can wear away the enamel, make the teeth sensitive. Also, you can get charcoal stuck in the gum.
And that can create
some other problems. So I don't really recommend that. Or
okay,
don't.
So what other cosmetic treatments do you do in office as well?
We do dental veneers, which we can talk about, or crowns.
What are the veneers?
What are the veneers? Basically, the veneers are made out of porcelain.
Okay.
And like I said, they're even making them out of zirconium now.
Okay.
But typically, they're made out of porcelain, and as I like to tell patients or describe to them, think of it as like a contact lens that goes on the front of your tooth.
Oh, I like that description.
Yeah,
Okay. So you use your regular tooth, and then you create a more defined tooth on top of
well,
that?
you have to shave away some of the tooth, and there are companies out there, you know, claiming, you know, you can have veneers that don't need to be shaved, your teeth don't need to be shaved down, and it sounds very attractive, and that would be great.
But it's not possible.
It is possible. The only problem is that your teeth enter the room before you do, because, you know, you're not shaving anything down, so there's a thickness.
Right.
So that's when you see
Bulky
these
teeth.
really bulky, horsey-looking teeth. So, I mean, maybe I've done one in a special type of case in, you know, 10 years, but rarely do I do them.
Okay. Thank you for that. Now, HPV is on the rise and has an important link to your oral health. Then we come back, we're going to cover important symptoms and preventative measures. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, call in. That number is 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com, where you can watch the Health Channel 24/7, and also download the Health Channel app for your mobile device or smartphone. It's free, available at the App Store or Google Play. We'll be right back.
Hello, I'm Dr. Agueda Hernandez with the Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital. Signs and symptoms of hearing loss are different for each child. If you think that your child might have hearing loss, ask your child's doctor for a hearing screening as soon as possible. Don't wait. Even if a child has passed a hearing screening before, it is important to look out for the following signs. Speech is delayed, speech is not clear, does not follow directions, often says, huh, and turns the TV volume up too high. Babies and children should reach milestones in how they play, learn, communicate, and act. A delay in any of these milestones could be a sign of hearing loss or other developmental problems. Contact your primary care physician if your loved one is showing any of these signs.
No one is more important to South Florida PBS than you, and nothing is more important to you than your health. Enter the Health Channel. Got questions? We've got you covered. Live with local doctors.
Great news, we have a caller.
And with our online video library from A to Zika, we've got you covered 24/7. Find us on Comcast and Hotwire Cable, download us on your phone or tablet, and visit us at allhealthtv.com. The Health Channel. All health, all the time. We've got you covered.
I may look like all the other dogs, but I was born for a purpose. To one day be your companion, your eyes to see the world. I'll be your courage, your friend. With me, you'll find new freedom and hope for a better future. A dog I'm not. I'm a Southeastern guide dog.
Making some lifestyle changes, you can help prevent or delay prediabetes from turning into type 2 diabetes.
9 times out of 10, people are just not eating enough vegetables. Fiber is one of those things that we don't talk often enough about, those green leafies, whole grains and fruits. It actually helps to make you feel fuller, and it also helps control blood sugars.
Hi, May. Do you have a question for Amy and Shannon?
Hi. What foods do you recommend for diabetics?
In general, with diabetes, what we look at are the carbohydrates and balancing it then with the proteins and those non-starchy vegetables.
Welcome back to the Health Channel, all health, all the time. I'm your host, Kathy Buccio, and with me is Dr. Howard Abrahams, a maxillofacial prosthodontist, almost there, at Dental Implants in Miami Beach. If you have a question, call in. That number is 855-796-4475. We'd love to hear from you. Now, according to the Centers for Disease Control and Prevention, most people are exposed to HPV in their life, and a small portion of the population has oral HPV, which can infect the oral cavity and cause cancer. And these types of cancers are on the rise. Let's watch.
Cancer of the oral cavity and pharynx is cancer that forms in the mouth or throat. Oral cavity cancers can occur in the lips, gums, front part of the tongue, salivary glands, and inner lining of the cheeks, the roof and bottom of the mouth, and the area behind the wisdom teeth. Cancers in the pharynx or throat can occur in the nasopharynx, or the part of the throat behind the nose, the oropharynx, which includes the tonsils, the base of the tongue, the back of the roof of the mouth, and the side and back walls of the throat, and the hypopharynx, or bottom of the throat. Oral cavity and pharynx cancers are more likely to develop in the tongue, oropharynx, tonsils, gums, and salivary glands. Because smoking rates have decreased, new diagnoses of smoking-related oral cavity and pharynx cancers have dropped. However, cancers associated with human papillomavirus, or HPV, are on the rise. Approximately 70% of cancers in the oropharynx are caused by HPV infection. Human papillomaviruses are a group of over 200 related viruses. More than 40 HPV types can be easily spread by vaginal, anal, and oral sex. Persistent HPV infection causes cellular changes that can lead to different types of cancer. White men have the highest rates of new cases for oral cavity and pharynx cancer, followed by black men and American Indian and Alaska Natives. These groups also experience major differences in survival rates. The 5-year relative survival rates are about 68% for white men, but only 45% for black men. This means that 5 years after diagnosis with oral cavity and pharynx cancer, 68 out of every 100 white men will still be alive, but only 45 out of every 100 black men will survive that long. Some of the gap in survival rates is because black men are often diagnosed at a later stage, when the cancer has spread to other parts of the body. One way to improve survival is through early detection. Some of the signs of oral cavity and pharynx cancers include a sore throat that does not go away, a lump in the nose, neck, throat, mouth, gums, or lips, trouble breathing, speaking, chewing, swallowing, opening the mouth fully, or moving the tongue or jaw, ear pain, or a change in voice. If you experience any of these symptoms, talk with your doctor. It is important to be diagnosed and treated early to improve your chances of survival. Take steps that may reduce your risk of oral cavity and pharynx cancer. Eat well. Be active. Don't smoke or use tobacco. Avoid alcohol. Get vaccinated against HPV.
This is really interesting, Doctor. Are you seeing these rising rates in your own work?
What I'm seeing is people who are non-smokers, non-drinkers, coming down with some sort of oral cancer. Would I say there's a lot of this happening? Well, I think, fortunately, and you know, the idea is not to scare everyone. Mm-hmm. You know, the chance of getting oral cancer is very low still compared to, you know, all these other cancers that you hear about. But, you know, in my world of maxillofacial prosthodontics, where it's kind of concentrated, I would say yes. I've seen an increase in younger patients, non-smokers, who are coming down with this. And in the past, we really did not see that.
Wow. So we actually have a caller on the line. We have Dominic from Lighthouse Point. Hi, Dominic. Are you with us?
I sure am.
Hi. Thank you so much for calling in. Thank you. You have a question for the doctor?
I sure do.
Go ahead.
I have multiple myeloma, and my chemo guy says I'm, excellent right now. And so now I'd like to I had 4 teeth removed into the jawbone so that I could have implants. And when I went to my dentist, and he says something about that I can't have it done because I might have had a drug then when they were taking care of my chemo, and I should wait maybe a year or maybe forever. What is going on there?
Okay.
Thank you, Dominic.
Thanks, Dominic. It's a good question. Probably what your dentist is fearful of is something called bisphosphonates. It's a drug that is used similar to patients who have regular osteoporosis. However, patients with cancer will very often be treated with a bisphosphonate, which is supposed to strengthen their bone. However, it's in such high concentration, and what ends up happening is you run the risk of getting necrosis of your jaw if it's traumatized. So, for example, if you've had this type of drug from your cancer treatment, you would be very wary of having teeth pulled out because that's a trauma, or having any type of gum surgery. Certainly implants can potentially cause necrosis or death of the jawbone, which is something you definitely not want to do because it can cause a lot of issues. So I think it's important that you find out, number one, what type of drugs you were treated with, or maybe even being treated still to help protect your body against your disease. And you definitely have to be careful. I would definitely speak to the oncologist and get their input into it. Also, I'm trying to think if there's anything else. Those are the main things. You want to make sure that you haven't had this drug. On a side note, anyone who has osteoporosis, which is many people in the world, you also have to be careful with these types of drug, bisphosphonates. Although the chance of having problems is much less than someone who's been treated for cancer, because just the dosage is so low, you have to look into that. Sorry, I know.
Go ahead.
You asked if implants are ever going to be an option for you, and maybe you should go off of the drug for a year. Well, the truth is, these types of drugs stay in your system for about 10 years. So going on what's called a drug holiday, I don't think is really scientifically sound. You'd probably have to wait about 10 years for it to get out of your system if it's worried. There are also other tests that you can do. It's called a CTX test. I know they do them in the University of Miami, and it measures the level of this drug in your body and bone, and that may be something you might want to look into.
Thank you, Dominic. Hope that answers your question. Now, as we continue our discussion, I do want to remind our viewers, you can call in if you have a question. That number is 855-796-4475. We would love to hear from you. Now, at what age are people getting these cancers? And we're seeing also many cancers that are diagnosed because of HPV. So what is that correlation?
Right. So typically, oral cancer was seen in middle-aged men, history of smoking, alcohol use, and the idea is that drinking all this alcohol and smoking basically is killing a lot of cells in the mouth, and that turnover increases the chance of you getting a cancer. Now, with the HPV, you're seeing it in people probably younger, maybe 40 to 55, mostly men still, and that's being attributed to really a lot sexual practices. HPV is the most common STD out there, and it can be passed. And culturally, people are having more sexual partners today. Also, I think oral sex and even anal sex are more in vogue today.
Right, and that puts you at a higher risk.
Puts you at a higher risk just because HPV, cervical cancer, when they do pap smears, they're looking for HPV. So all these, things are related, and I think is
something to look into, yes. Now we have some signs that could be symptoms of oral cancer, and I want to take a look at those with you, doctor.
Sure.
For sores that won't heal.
Yes.
It's in your mouth, correct?
Sores that won't heal for more than 2 to 3 weeks, you want to look into that.
Okay. And you have loose teeth as another symptom. Are these common symptoms?
I mean, it has to get pretty advanced. You know, sores that won't heal, that's the best time to get it. Well, screening by your dentist is the best way to, you know, prevent the cancer. But when your teeth get loose already, that means that the cancer has gotten sufficiently big enough to actually start moving these teeth. Mouth pain, yeah, you know, you could have a sore under your tongue. And I mean, when I was, you know, doing my training and also my practice, you see patients with growths in their mouth, and you think to yourself, you know, how are they living like this?
Right, because that is extremely painful.
Yeah, and they said, well, I think it's just a lack of education. They don't know, you know, why is this happening in my mouth?
Right. Wow. That's great. Okay, so stay with us because we will have some final tips when we come back. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, call in. That number is 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com, where you can watch the Health Channel 24/7. Also, download the Health Channel app for your mobile device or smartphone. It's free, available at the App Store or Google Play. We'll be right back.
It is the most amazing gift that you can give someone. You're seeing individuals have an opportunity of their lives that they would never have again.
The Health Channel, a service of South Florida PBS, was created for you to provide the highest quality health and wellness for our community. Everywhere you go, we're here 24/7. Watch us live and get your health questions answered.
Thank you for calling into the Health Channel.
Or find topics that interest you from our comprehensive online video library. Find us on Comcast and Hotwire Cable, download our mobile app, or visit us at allhealthtv.com. The Health Channel. All health, all the time, everywhere you go.
Hey everybody, this is Gavin DeGraw. I've seen firsthand the effects of pancreatic cancer. My mother, who was considered very healthy, is diagnosed with stage 4 pancreatic cancer. I first heard about Lustgarten right after my mother was diagnosed. It's a great organization. 100% of the money goes specifically to cancer research. They know what they're doing. They really can help. I encourage everybody to get involved with the Lustgarten Foundation.
I was diagnosed with diabetes and I was on a downward spiral. I use running to find myself, but I also incorporate some of the eating habits that I learned as part of the Florida Blue pre-diabetes program. I've done 15 5Ks in the last 12 months, shedding all the weight. It's just been amazing. I love being the healthiest version of myself that I can be. I'm Rita, and this is my kind of blue.
Heiny, tushy, badonkadonk, call it what you want, but talk to your doctor because the American Cancer Society says colon cancer is a leading cause of cancer deaths in the U.S. I was diagnosed with colon cancer, but I might have avoided it completely if I just had my keister checked. So get off those juicy doubles and go get your rump shaker screened so you can say you literally saved your own. Can we change padonkadonk?
Make-A-Wish grants a wish every 17 minutes. I know that sounds pretty magical, but in fact, it takes more than magic. It takes muscle. So, when a kid like Fabian wishes to be a superstar, things happen. Whoa! Or when Kahim transforms into Super Kahim. He feels invincible. It's because wishes have proven physical and emotional benefits that can give children with critical illnesses a higher chance of survival.
Help us make sure every wish comes true. Join us at wish.org.
Families come in all sizes and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. But what we know is that you want to protect the people that are close to you, but the flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself, protect your family. Everyone needs a flu vaccine.
Welcome back to the Health Channel, all health, all the time. I'm your host, Kathy Buccio, and with me is Dr. Howard Abrahams, a maxillofacial prosthodontist at Dental Implants Miami Beach. We got it, didn't we? We did. If you have a question, call in. That number is 855-796-4475. Now, as we wrap up this hour on dental health, I do want to leave all of our viewers with some helpful tips. First of all, so how can people find a dentist that fits their needs? Because I know there are not many maxillofacial prosthodontists around.
There are not. There's very few in the country, and really the maxillofacial part is for cancer patients. But if you're someone who really has a lot of dental work and they don't know where to turn, you should be looking for a prosthodontist, which is a specialist in replacing missing teeth.
Right.
So that's.
So then at what point should a patient see go beyond seeing their dentist?
Well, I think if you're general, you should definitely see your general dentist and be under their care. And at some point, your general dentist may suggest to you, I think you should probably see a prosthodontist. This is getting, very complicated. Mm-hmm. Not to say that there aren't general dentists out there that are capable of handling large cases. There are many great general dentists. I don't want to seem like that, but this is kind of what we do, and and even the patients. Patients are very savvy today with Google and internet, and they know more than they used to know. So they don't have to be in the dark. Google. Dental implants, prosthodontist, all these kinds of things, and you could also ask your other specialists. Let's say you've been to an oral surgeon for wisdom teeth extraction, or you've had a root canal by a root canal specialist. Very often, they will know to send you to the right people if you don't have someone already.
Absolutely, use the resources. Now, dentists always say they can tell a lot by our teeth. So when it comes to our dental health, how much of it is linked to the choices that we make and our lifestyle?
I think it has everything to do with lifestyle. A lot of times patients will come in and say, oh, my father had bad teeth, so I have bad teeth. There may be some truth to that, but I believe it has to do, well, if your father was drinking Coca-Cola at the table, then the kids were probably drinking Coca-Cola also. So that, that probably has more to do with it. Also, patients don't realize, a lot of times, I'll ask a patient, are you, do you drink soda or sugary drinks? Oh, no. I'm like, do you drink coffee? Oh, yeah, all day long. Yeah, do you use sugar? Yeah, a little bit. Actually, sipping on something all day long is much worse for you than gulping
Probably
it.
having a can of Coke.
Yeah, like if you're gonna have Gatorade, gulp it down. Don't sip on it all day because you never gave your mouth a chance to recover.
So I should not be sipping on my tea all day?
Well, is there sugar in there?
No.
Well,
I'm okay.
You get an A+.
But I understand that coffee and something like tea, even red wine, they can stain your teeth.
Yes, they can. Staining is okay. It's not. Staining doesn't necessarily.
Well, then I just have to come to your office and get my teeth whitened. If they're stained.
Stained teeth don't necessarily mean that your teeth are unhealthy. It's
right.
just they might not look the best.
But I like that the sugar in the coffee. You don't think of that. You just.
Right. And Starbucks, give me a break. How much sugar is in those things?
Frappuccinos are loaded with sugar.
Of course.
Absolutely.
People don't realize.
Okay, here's another thing that happens, and I think it happens also as you become an adult. You go less and less to the dentist because you think teeth are fine, I'm fine, or sometimes you just don't want to go because you don't want to go to the dentist. This is not good.
Not good. Don't learn from her.
No, I go to the dentist every year, twice a year. So learn from me. Yes, I do go.
No. Yeah, certainly adults neglect themselves more than. Well, it happens all the time. A mother gets pregnant, let's say.
Right.
And she has a kid, another kid. And it's like, oh, I've been so busy. I haven't been. Yeah, and then they come a few years later, and their mouth's a mess. Their teeth were fine before they had children because, they had time for themselves. And when you don't have time for yourself, that includes not having time to, take care of your dental needs.
Absolutely, but you should absolutely be making those appointments with your dentist. Now, I want to leave our viewers with some helpful hygiene tips. So let's go over some dental myths that might lead to healthier habits. The first one is sugar is the main cause of tooth decay. Is this true or false?
This is true.
Okay.
I would say this is true.
You are going to say true?
Yes.
Okay.
What happens is the sugar will break down, and bacteria needs sugar in order to create acid. So when you have bacteria plus sugar, they create an acid. The acid is what eats away at the enamel and causes the cavity. So that's true. And it's interesting, who has cavities in the animal kingdom? It's people, because we eat sugar, and dogs, because sometimes they eat people food. Anytime you give people food to animals, they run the risk of...
Sometimes those dentist bills for those dogs are a lot more than people.
Well, yeah, I know. We see dogs on the weekends in my office. No, I'm joking.
Okay, I was like, wow. Okay, so the next myth is mouthwash with alcohol is the most effective.
Yes and no. I would say, so mouthwash with alcohol, the alcohol will definitely kill all the bacteria. The problem is it dries your mouth out terribly.
Okay.
And it's the saliva that is helpful to keep your mouth clean and hydrated. So you're really drying your mouth out. So on one hand, yes, immediately it is effective, but throughout the day it's actually not good because it dries you out. Better to use a mouthwash without alcohol.
Okay, mouthwash without. Now, another surprising one, white teeth are healthier teeth.
Well, listen, I think I've had a lot of patients who come in with super white teeth and their gums are all bleeding and they have periodontal disease, so it can be deceiving. It's not necessarily white teeth are the healthiest, but it does show that the patient has a degree of awareness of their mouth, so I guess they're less likely to have issues.
Okay, so then that brings me to my next question, because if you have the bleeding gums or if you have that periodontal disease, then brushing them is a good idea or not a good idea?
No, if you have bleeding gums, you should definitely be brushing. It happens all the time. Patient says, I said, why aren't you brushing your teeth or flossing your teeth?
Right.
Oh, whenever I do that, I'm bleeding all over the place. I'm like, that's the problem. You never brush your teeth. So it's a cycle where you keep bleeding.
So basically, the less you bleed, the more, as you do this, the better.
Yeah, it toughens up the gums. It's like a guitar player with their fingers. They're calloused. From being used, so that you need that. The less bleeding, the better.
Okay.
So even if at the beginning you're bleeding a lot.
Okay. So for oral hygiene, what is your best advice?
2 minutes. You need to brush your teeth for 2 minutes.
Really?
Yes. Oh, so you didn't know that?
I did not know that.
And she's been going to the dentist a long time.
Yes. I pay attention, I promise.
Okay.
I'm gonna need one of those timers I have for my kids where I time their...
Well, those are 2 minutes. If you actually look how long they go for, it's 2 minutes. And why is it 2 minutes? Well, because it's a long time, 2 minutes.
Right.
So if you're doing it, even if you're brushing your teeth wrong, if you're brushing it for 2 minutes, you're
doing something right.
Yeah, you're doing something right.
Okay.
Most people say, I brush my teeth all the time, twice a day. Done.
So that means you've been useless, right?
Yeah.
Okay, I do want to finish with kids because obviously, we're the role models for the kids, but also kids, and I have 2 of them, it's a battle sometimes to brush the teeth. Then I have to buy all these cartoon toothbrushes so they can brush their teeth. And now I'm scaring them with falling teeth. So what is some of the best advice you have for kids to start their hygiene when they're young?
Well, I would say you need to tell them 100 times a morning. For many years until it is ingrained. I have my own Nathan at home. I have 4 kids, but my little one, Nathan, he's 7 now. So now he brushes his teeth. But, from ages, 3 to 6. It's every day. Did you brush your teeth? Did you brush your teeth? And I'm a dentist. You know, you would think.
Yeah, you would think this happened. I mean,
Yeah.
come on, you're pointing fingers at me. I'm pointing fingers at you. It was great to have you. Thank you so much for being on the show. That does it for us this hour. Be sure to join us next time on the Health Channel. All Health, all the time on South Florida PBS. And follow us on social media at AllHealthTV, hashtag AllHealthTV. And you can also visit our website, allhealthtv.com, where you can watch videos from previous episodes. Also, if you haven't done so already, download that Health Channel app for your mobile device or smartphone. It's free. Available at the App Store or Google Play, and you can rewatch this episode. I'm Kathy Buccio. I'll see you next time.